Today's episode is sponsored by CCRN, a precise urine output monitoring system, and so much more. As a rapid response nurse, I know that early detection of patient decline can make all the difference. CCRN's monitoring platform is transforming how we predict and respond to patient deterioration. With precise data on fluid balance, intra-abdominal pressure, and core body temperature, CCRN gives healthcare teams advanced insights that are often missed with traditional methods. And this technology doesn't just alert, it gives us the time and clarity we need to make critical decisions before it's too late. And it even has features like active line clearance to prevent problems like catheter-associated urinary tract infections from ever even occurring. And if they hadn't already thought of everything you could possibly have wanted in a bladder catheter, well, CCRN can also link up with your electronic health record to document your urine output measurements. So cool. If you want to hear more about how CCRN is leading the way with technology that helps patients and lightens the workload of nurses, then you can check out episode 121 of the podcast. And I put a link to their website in the show notes for you. This, guys, is the future of patient care. Check out CCRN for yourself. Now, let's dive into today's episode.
We asked for directions on how to get to this hospital. And they said, honestly, we don't know because the roads have been closed. We don't know what's open, what's not open. Our best to just start going down this road and finding out where the detours are. So we started driving.
And you don't have like GPS on your phone.
No GPS.
You're just driving through the mountains.
No service, SOS on the phone.
Oh my gosh.
So I have no idea where I am. All you see is just destruction everywhere. There's trees down. There are buildings that have roofs, but no building sides anymore. You can see where water levels were to the roof and everything inside was completely destroyed. All the traffic lights are out. There are no traffic lights working. And it looks like one of those scenes from a movie where there's just dirt covering everything. And it was the mud and clay from the river that had flooded over. And so getting to the hospital itself was very, very stressful. But when we arrived, it was well worth it.
Hey there, I'm your host, Sarah Lorenzini, a rapid response nurse and educator who loves telling stories to teach critical thinking. This podcast is for nurses who want the knowledge, skills, and confidence to respond to any emergency. With almost 20 years of experience in the ER and critical care nursing, and a master's degree in nursing education, I have a lot of stories to share, and I love to nerd out and break down the pathophysiology, pharmacology, and nurses' role in emergencies. Stories bring learning to life. It is way easier to learn from and remember the stories that my colleagues and mentors have told me than anything I've read in a textbook. And that is why I made this podcast. Every episode is packed full of exactly what you need to know to handle whatever crisis that could arise on your shift. It's one thing to get the right answer on the test, but knowing how to detect when your patient is declining and what to do when your patient is crashing is what will make or break your day and might just save your patient's life. Welcome back to the Rapid Response Run podcast. Today I have with me my good friend Brooke. Welcome to the podcast studio.
Thank you. Happy to be here.
So today we're talking about hurricane nursing. Our state has been hit by 2 hurricanes in this month, but Asheville also got hit devastatingly by Hurricane Helene. So Brooke was actually deployed to Asheville, and I was deployed to Tampa just like a week and a half later. So what we're going to share about today is just our experiences, what we've learned from it, and kind of like the beauty and humanity that comes out in the middle of crisis. So before we dive into like some stories about hurricane nursing, Brooke, can you just tell everyone how long we've known each other, where we met, and like what you've been up to since then?
Absolutely. So in 2013, I started in a CVICU, and I remember meeting Sarah because she was one of my preceptors, and she drew this beautiful hemodynamics model for me on a piece of paper and was very passionate about making sure I understood preload, afterload, and contractility. So since then, I've stayed CVICU and have just been a nurse leader for the last 8 years of my career now. So it's very exciting.
Yeah, so CVICU bedside, and then you were CVICU educator, and then CVICU manager, and then CVICU director, and now you are
Assistant Chief Nursing Officer.
Yeah, girl. So proud of you. So proud to call you friend. Okay, so let's talk about the hurricanes. So Hurricane Helene kind of like brushed through Florida, did some damage, but man, it really was catastrophic what happened in Asheville. And then our hospital that we work for has a big hospital in Asheville, and they actually deployed a bunch of nurses from all over the country, actually, to go help out in Asheville. And Brooke was one of the nurse leaders that was sent from her home hospital to go stay for how long were you in Asheville?
I was there for 5 days. I was sent home early because of Milton.
Okay, so she went there for 5 days, but then, a hurricane's coming to your own hospital. You should probably go back home and help there. Okay. So then she came back to Florida. And then Milton hit, I don't remember the day.
It was a Wednesday.
It was a Wednesday. Okay. By Friday morning, I was in Tampa helping out there from the aftermath of Hurricane Milton. This has been such a challenging but also like beautiful experience. I mean, I've been a nurse for 20 years in Florida, so lots of hurricanes that I've dealt with. I've been Team A more times than I can count. I'm used to sleeping on the floor of somebody's office for hurricanes. Like, this is something we do all the time. But these last 2 hurricanes were different. So I'd like to just start out with, how did you get looped into going to Asheville? Did you volunteer? Did they ask you?
Absolutely. So when our hospital was hit in Asheville, they knew immediately that resources were going to be needed to help support the patients there as well as the staff there, because it was destructive to not only the hospital, but also to people's homes that they live in. So there was a volunteer sign-up that was sent out, and I put my name on. I think I was asked Saturday morning, and by Saturday at 11 o'clock, I had talked to my husband and put my name on the list to go. And then I was contacted probably 3 days later to be in the second wave of deployment. So I was not the first wave that got there right after the hurricane, but I got there about a week later.
Okay, gotcha. And then can you just walk us through, like, whenever you first arrived in Asheville, what did you see? Absolutely. What did you feel? What's it looking like?
So landed on the plane in Asheville, which I was surprised they were landing in Asheville. But we landed in Asheville and got into a rental car and started driving, and quickly noticed that your cell phone doesn't work. There are no traffic lights anywhere. All of the roads are closed for the most part. We luckily found a gas station that was open and asked for directions on how to get to this hospital. And they said, honestly, we don't know, because the roads have been closed. We don't know what's open, what's not opened. There's, such quick changes. Our best to just start going down this road and finding out where the detours are. So we started driving.
And you don't have like GPS on your phone.
No GPS.
You're just driving through the mountains.
No service, SOS on the phone.
Oh my gosh.
So I have no idea where I am. I should have, looked it up before I got there, but get there, start driving, and all you see is just destruction everywhere. There's trees down. There are buildings that have roofs, but no building sides anymore. You can see where water levels were to the roof, and everything inside was completely destroyed. All the traffic lights are out. There are no traffic lights working. And it looks like one of those scenes from a movie where there's just dirt covering everything. And it was the mud and clay from the river that had flooded over. And so getting to the hospital itself was very, very stressful. But when we arrived, it was well worth it. And when we walked in the building, the nurses that were there, the nurse leaders that were there, seeing another wave of people coming in, I have never seen such relief and happiness to have more reinforcements there.
Okay, so you arrive in Asheville. Like, around what time did you finally make it to the building?
I think we were on site by 12:30.
Okay, so like midday.
Mm-hmm.
Okay. And then once you arrived, what's like the vibe there? I mean, I'm just imagining chaos, but you're 5 days in at this point.
5 days in. So we were Team B. That was our Team B coming in after to relieve Team A. And when you've been tired and you're very loopy, but you're energetic because you're running on just some steam that you don't know where it came from. Mm-hmm. Every single person in the building was like that. Okay. And so as soon as they see relief coming in, they're ready to just give you all this information. I mean, the Team A that was there, they were instrumental in putting up all types of protocols and getting resources there for the staff and the patients. So walking in, I was trying to absorb all the information from the other nurse leaders that we were relieving. And it was information overload. I mean, It was just like you were ready to go and hit the ground running. And then by the end of the day, you could just see the relief wash off of Team A. Like, there's people here, they're going to stand up and continue to do what we did. And then they got to go home to their families.
It gives me chills to think about that, Brooke. Like, how beautiful is that?
Absolutely.
That you're able to come in and like use your skills, your experience to support this team that's just been through hell. What were they talking about? Like, what was it like the first wave? I know you probably had a better experience than they did.
Yes. So the first wave that got there, from the stories that I've heard, when they got there, there was no power, no water, no real communications with the outside. When the first wave got there, some of them got there the morning after the storm. And a lot of the people working in the building didn't know if their families were okay or not. So, and if the employees that were not activated on Team A, not knowing if they're okay or not, there's no way to contact anyone from the outside. Some people ended up going 96 hours without knowing if loved ones were okay or not. And when I got there a week later, they still hadn't located a few employees. And I think the count when I got there, Asheville was still missing 1,000 people in the community. So no power, no water, no communications. And so really at that point, it was trying to figure out how to get resources in to help. So having drinking water, obviously, and food for the patients. And then it quickly shifted to taking care of the staff. How do we support the staff in this? There were, rooms set up for people to sleep in on the cots. So everyone did have a place to sleep. And then there were water trucks that were brought in to help supply water into the hospital. And so that helped a lot to be able to get potable water to the patients again. And then actually Team A set up showers for the staff outside. And so they figured out a way to have showers brought in with water, with enough water pressure to supply not only that, but also the building inside. So that the people that were staying there and sleeping there were able to shower as well.
So basically, there's like no running water anywhere in all of Asheville. There's no power anywhere.
No.
But the hospital is like this beacon that somehow has running water and power because of the generators.
Correct.
Who supplied this water for that area?
The company that we work for.
Okay, so they brought in their own resources.
They contracted, I believe it was from all over, from Florida, Georgia, Tennessee. It was resources from everywhere.
Okay. Wow. Where did you sleep while you were there?
I slept in a hotel.
Okay.
So the company that we work for had supplied resources to hotels so that we could have running water in there so that we could get extra people out of the hospital and into other areas.
What do you mean by extra people?
So any staff members that were displaced from their homes, they didn't want them to be sleeping in unsafe situations. So they were having them sleep in the hospital until we were able to get the hotels up and running. And so the company that we work for supplied water and power to 5 hotels to put up staff members that were displaced from their homes so that they had a safe place to sleep at night with their families.
I know when I was in Tampa, the devastation wasn't as bad, but there were a lot of nurses that had no running water, no power, nothing. And they actually put them up in hotels as well. In fact, whenever we were in Tampa, like whenever I drove in, as you described, there's no power anywhere. There's no street lights. There's like random cars just abandoned on the side of the road because there's no gas either. So people would just drive their cars until they ran out of gas and just park it wherever they landed. So the staff also need gas to get to the hospital. So the hospital that we work for actually provided gas as well. They brought in a tanker and every staff member could rotate through and get free gas. They could get to and from work. And then they provided hotels for staff that had nowhere to stay. It was actually really cool to see how the company brought in reinforcements, not only human reinforcements, but also just resources to help the staff.
Like you were saying about Tampa with gas, there were no gas stations open, no grocery stores open, no fast food restaurants open. There were the occasional food trucks that were open if they were willing and able to get places. So the company that we work for actually set up what they termed a mega mart in one of the facilities. And what it is the employees would go by with their badge and they would say, I have a family of 5 at home. And they would give you enough food to feed your family for 5 days, for 5 people.
Wow.
And then there was a gas tank truck set up there as well. And you got a certain amount of gas, so that you could get to work and get around and do the things that you need to.
And this was free, just for being an employee?
Free. Yes.
Okay.
Within the hospital itself were little employee resource centers, which had, different types of items that you might commonly need, cases of water, toiletry items. There were showers set up outside so that they could shower with laundering services so that you could do some laundry if you needed to. Scrubs available for people to wear so that they didn't have to worry about it. They actually contracted a tree removal company to remove trees from any houses that were in imminent danger to family members. And they sent that free of charge out to houses and removed trees off of buildings and homes and out of danger for the people that lived there that worked at the facility. Wow. And just thinking about how much our company took care of their employees is incredible. I mean, the resources that they have allocated to not only that community, but to the staff that work there and their families it's insanely beautiful to watch. You never really understand it until you see it.
Yeah. Can I just say, I feel like, because I watched the news a lot after all this, I'm like tracking the whole thing. I feel like all I saw was like, it's terrible, everyone's dying, no one has what they need. And I know that probably is partially true, but I feel like the news didn't do a good job of showing some of the beautiful stuff that you got to see firsthand. Like the staff coming together to help each other, the hospital corporation bringing resources for free to care for the staff, to give them transportation and food and running water and laundering services and even shelter. Like that's not really mentioned in the news. I just wanted to say thank you for sharing that so that at least some of us can know that there was still like some good stuff happening. Okay, so what kinds of things did they actually have you doing? You're there for 5 days.
So let me just say I'm in awe of how many people put their name on a list to go into the unknown, because there was no real information at the time when we all signed up as to how bad it was or what the circumstances were like or what you would even be doing. I packed 7 pairs of scrubs. I was going to be there for 7 days, stethoscope, and that was about it. That's all I took in my suitcase. And so when you walk on site and you're walking in the doors with all these other people, you know, regardless of what position you're in within the company, everyone walked in the door ready to do whatever it took to stabilize that hospital and to take care of those patients. And not only to take care of the patients, but to take care of the staff too. And so when we were there, we were helping to coordinate the return of the first wave of nurses back, and then the new wave of nurses that were coming in for bedside. We were helping with the operations to make sure that patients that were able to be discharged had a place to discharge to. There were government and federal buildings that were set up throughout Asheville to help. So they actually had a state medical center that was set up by the government, and it was basically a safe place to discharge intermittent until they could get to a safe home. And so we were coordinating that. We were helping make meals in the kitchen just to feed. We were feeding over 1,000 people at every meal. And anywhere I could be used in that time, I was happy to chip in. We were doing, patient rounds, just checking on patients. We were doing leader rounds and just checking on the staff that were working and making sure that if they needed some time away, that they had that time. There were a couple of times where people would get phone calls in the middle of the shift and find out something and they needed to step away. So we would go in and help. A lot of coordination, a lot of helping make sure that the operations of everything that Team A had stood up continued.
Gotcha. So as a leader, how would you describe just in summary what your role was there? And how is it different in such a high stress situation than like your normal role as the ACNO?
So normally I'm over nursing and I worry about all things nursing. But when I got there, I was worried about all things operations. And there was a lot of support for every type of position there. So there was a lot of different leaders from all over. And when I got there, the group that I was with was from Texas and Utah and Kansas and Florida. So I was in the operations team. So I was one of the people that they called a catcher. So any task that came down or any information the company needed to help continue to send resources came to us, and then we helped to get that information back to them. So this could be anything from how many more volunteers do you need? What type of support and resources do you need? How are these outlying facilities doing? Because there were other outlying hospitals that were also impacted. And so getting that information back so that we could continue to support the hospital.
Yeah. And when you say volunteers, they asked for volunteers, and I volunteered. But I actually was paid very well to go down there. Like I was paid for my time that I was caring for the patients. I was paid for my travel. Like I just drove because I live 2 hours from Tampa, although it took me 6 hours to drive to Tampa when it would usually take me 2 hours. But like nurses that came from California, Texas, Colorado, they were provided a plane ticket. Like everything was just arranged for them. So we say volunteers, but the company actually paid us to be nurses. We weren't just like giving up a week of our time and getting no pay. It was actually really, I was compensated what I feel like very well.
And the hospitals that we were leaving from also had to, make sure that they could take care of the patients in that facility with all the volunteers leaving. And so it was a lot of coordination on every level to make sure that this hospital got the resource that it needed and as quickly as it did.
That's awesome. So can you think of any specific like act of kindness or resilience that captured the beauty and humanity that you got to see while you were there? Hey guys, I just wanted to take a quick break to talk about something that I think is really important, and that is getting certified in your nursing specialty. Not because having the extra letters behind your name make you a better nurse, but because taking the time to deep dive into all that you need to know for your specialty, putting in the study hours, and dedicating yourself to mastering what your patients need you to know how to manage them best, the prep for the exam, is what will make you a better nurse. So whatever specialty you are currently working in, go study for that certification exam. And if you're a critical care nurse, I have something that will help you pass your CCRN. My friend Nick McGowan has an excellent online self-paced CCRN prep course called Critical Care Academy. It is so thorough, and he has broken down everything you need to know into little bite-sized digestible content that he calls micro-learning. Let me tell you, the CCRN is the hardest test I've taken in my entire life. You don't want to go it alone. You want to take this course to ensure that you know your stuff before sitting for the exam. If you'd like to check out his course, you can find it at ccrnacademy.com. And great news, just for being a Rapid Response RN podcast listener, you get 10% off the cost of the course by using the coupon code RAPID10 at checkout. So if you've ever considered getting your CCRN, do it. And let Critical Care Academy help make sure that you will pass. I'll put the link and coupon code in the show notes.
When we were helping load patients onto a med bus to go to one of these state medical centers, there were people that were upset. They were crying. They were fearful they weren't going to see their family members ever again. They were fearful they didn't know if their family members were alive or not. Mm-hmm. And I just remember looking over and seeing one of the leaders praying with another patient for the safe reunification of the patient. Knew nothing about this person. Wasn't from North Carolina. Wasn't, a part of anything. And just seeing that and seeing kind of how everyone then circled around the patient and just prayed with them and made sure that everything was okay was pretty impactful for me. And every time you walked into a patient's room, the first question the patient would ask you is, "Thank you for being here. Where are you from?" Aww. And because you're wearing your hospital logo from where you're from, and so they know that that is not the hospital they're currently in. And they were beyond grateful that you were there and not worried at all about what they were doing in the hospital at that moment in time, which was really impactful to see. And it was beautiful to see that no matter what position you held in the company, when you were in those doors, every single person was there for the same reason. And I've never seen collaboration and just kind-heartedness like that ever. It was amazing.
That's beautiful. I had the same experience with the patients. Like, I give a lot of hugs to patients. I'm a hugger. But I gave way more hugs per patient than I'm used to giving, just because these people are coming from such terrible circumstances. And to see a nurse providing such good care when they've been under in a really difficult environment, they just were so much more grateful. I mean, I got so many hugs when I was there. When I arrived Friday, the hospital I went to, it's a 70-bed ER. They had 150 people in the ER. Most of them boarding, waiting to be found a place upstairs. The waiting room had 50 or 60 people. It was just exploding at the seams with patients. So you think it would just be a big angry mob in the waiting room? No. These patients were just so glad to have power, to have someone giving them water and a blanket. They were so grateful, so grateful. One patient that I will always remember, he was the sweetest human. He was a retired professor, so very intelligent man. And right before the hurricane hit, he had a stroke, fell to the ground, and couldn't get up. And he was on the floor for 3 days and couldn't move while the hurricane's coming in, and he could hear it all around him, and he physically cannot get up off the floor. And he said, usually my neighbors would come check on me if they hadn't seen me out and about, but they had all evacuated. And so he's by himself, in his house with a hurricane happening around him. And after this, I'm trying to cry because he's such a precious man. And after the storm kind of blew over and people started coming back to see the damage in their neighborhood, they went and checked on it and they found him. But of course, by then, now he's in rhabdomyolysis and kidney failure. I mean, it's just a multitude of things that had occurred. And I just imagine him by himself in his house. He was so kind and so grateful. I would do the littlest thing, get him a blanket or help him brush his teeth. And he was just thank you so much. You were meant to be a nurse. This is what you were called to do. You're so good at this. Thank you so much for your care. I feel so much better being here. an absolute privilege to be his nurse, an absolute privilege. He was on an ER stretcher for longer than I'd like patients to be on an ER stretcher. Got him a hospital bed. You would have thought I brought him like a Cadillac or like a limo. I mean, he was so excited to get in a hospital bed. He had, decubitus ulcers because he'd been on the ground for a little while. So we had positioned him a little bit more comfortable. It was just such a privilege to care for patients like that. I had another patient that as she's getting checked in, I put her on the monitor, registration is there. And she's like, ma'am, do you live at blah, 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 something Cherry Lane? And she just starts crying. And she says, what's left of it? And I was just like, oh my gosh, like there is nothing that I'm facing right now. Okay, I'm sleeping on a cot with 35 other people in the same room. Mm-hmm. No big deal. I got this because I have a home I get to go home to. She has like nothing to go home to. Like after discharge, so many of these patients didn't even know
where they were going,
where they're going afterwards.
Yeah.
It was devastating, but it was also at the same time just such a privilege to be there with people and walk with them through things like that. I feel like that's where we like rise to the occasion as nurses, like we can handle the heavy emotions. Like we can share space with people and hold space for people who are in crisis. So a lot of what I did was not just like passing out medications and listening to lung sounds. It was just like being with people and listening as they talked about what they're facing. And I was so happy to do it.
Absolutely.
So happy to do it.
Multiple times when we were there, we got commented for bringing light.
Yeah.
And we were trying to be sensitive to the situation too and what everyone's going through, but at the same time trying to, spread some positivity and just some love around. And, usually I complain during the hurricanes of having to sleep in the hospital or going without power after the hurricane for 24 hours.
Oh, no.
But walking in and knowing that some of those leaders in that hospital went 4 days without knowing if their family members were alive or not, totally different perspective. And, I told my husband, I called him that night when we finally had cell phone service in Asheville and just told him I'm sorry for ever complaining about this because it's just nothing compared to what these people are going through right now.
Yeah. Definitely. Being a nurse in general just puts things in perspective, right? Like how bad can your day possibly be? And then you meet the patient that just got a new cancer diagnosis. You're like, okay, that was hard. But what they're facing is so much harder. I can be grateful for what that I have. What were some of the most pressing like medical or logistical challenges you encountered and how did you and the team work to overcome them?
I think the biggest thing is the capacity of the hospital and the no running water in Asheville. Mm-hmm. Yes, we had water tankers, but there's a finite amount of water in those tankers. So the frequency at which you're changing them out impacts a lot. And so the safest place for the patients is to be, and if they are a lower level of acuity and waiting to go home or to a facility, is trying to get those people placed somewhere else that's not using as much of the resources. So this hospital can still continue to care for all of the higher acuity patients that are going to happen in the emergency. I also learned an interesting fact that about 7 to 10 days after a hurricane is when you start to see fungal infections and GI bugs because people start drinking water in places they shouldn't, or from the amount of water that's in the air and in the walls and everything else. And so planning for that surge in capacity as well to treat those patients. So logistically trying to figure out how to get patients to the best place for them and to be able to continue to provide services for the community that was there. Yeah. I learned a lot. And, think through different situations that you've never really had to think of before. You think patient going to discharge to home. Home is not there anymore, or it's not safe for them to go. They're oxygen dependent and there's no power where they're at right now. Yeah. Literally the only thing holding them is the fact that they need home oxygen. So it was definitely thinking through some situations in different ways that you haven't had to. And it made you realize how much you take for granted in every day in terms of the resources and how to get patients placed in places that are most appropriate for them.
Yeah. How did you maintain morale and like energy, both for yourself and like also for the team, given like the emotional toll of what you guys are facing? As a leader, that's an important role that you play.
It is. I tried to remind them of why they were doing what they were doing and tried to get them to talk about things, as much as they were willing to, because it is hard, and just thanked them constantly. I tried to be the person with the candy that comes around and, just tried to spread a little joy and really interact with them and smile. There are times when it's not appropriate to smile, and those times you have to just listen. That's the best thing that you can do for them is really just listen to them. I don't know that I really understood how much of a toll it took on me until I was on the plane home, because you're just so encompassed by everything while you're there. Walking 25,000 steps and standing on your feet for 18 hours before you realize that it's, 10 o'clock and you should probably eat something. But it was just, I got so much joy out of that and satisfaction out of knowing that I was helping other people. Even that hug when you go to hug someone and then all of a sudden they start crying because they didn't know how bad they needed that hug. That's kind of what it was like the whole time. And it was nice to be able to just be a fresh face and offer that to them.
Yeah. I know the nurse manager from the ER that I was deployed to, she was making rounds at everyone, came to check on me, and she's like, "What can I get you?" And I was like, "Honestly, I need a snack. Like, I have been going. I actually cannot take a break right now because I just got this new stroke alert and I need to get them settled." She's like, "I got you." She went to the cafeteria. She got me a whole meal. She brought it back. She sat me down. She said, "Eat this." And she did a couple tasks so that I could scarf it down. But yeah, the nurse leaders were constantly rounding and checking on everybody and seeing what they needed. And they played a crucial role in the whole thing as well. So I can only imagine how awesome you were when you were there, because I have seen you in action. I've seen you as a nurse leader. Whenever you show up, it's like, okay, we got this. Brooke is here. We can handle this. You just give that confidence that this team can pull this off. So I'm sure you were so appreciated there. What would you say was the biggest lesson that you learned from your deployment that you've brought back to your role now?
When we have emergency preparedness and, everyone goes through the drills and oh, this will never happen to us. Oh, this will never happen to us. When I say that every single thing that we have ever drilled happened to this hospital, it happened.
Yeah.
And so I think the biggest thing that I've learned is to take those things seriously. Not that I didn't take them seriously, but you just kind of go through the motions and you don't think about all of it's almost like you have to enter those emergency preparedness with the most pessimistic mind ever and say, okay, but if this fails, what would you do? And if this fails, what would you do? And I think I've learned as a leader to poke holes in every single thing when it comes to emergency preparedness and be prepared for things that you didn't even think were possible. And so that has been my new kind of outlook in the rest of hurricane season, coming back. There are questions now in emergency preparedness at our level that are asked because of lessons learned at this hospital.
Yeah.
Things that they didn't think that they would have to plan for and found just how useful they were. And so those questions are now looped in the preparedness calls. And, I heard someone say, well, I don't understand why they're asking that. And I said, oh, I do. Seeing these water tanker trucks and these water pressurizers outside, you understand exactly why they're asking those questions. And so that is the biggest lesson that I've learned is poke holes, continue to figure out ways that something is going to fail in an emergency like that.
So if you were to give any advice, reflecting on your experience there, any advice to another nurse who might find themselves stuck in a hurricane or some sort of disaster situation, do you have any words of wisdom or advice you would give them as they prepare and as they face the challenges?
I would say that the sense of team is the most important, and to lean on your coworkers, to lean on the people around you, even if you have known them for 2 seconds. I will tell you, I made some friends while I was there that I met for 5 minutes and knew that we were going to be, bonded for life over the situation. No one ever needs to go through anything like that alone. And when you ask for help, help will come. And, especially when you're new in your career and you're not sure who to ask the question to, or if you can ask that question, ask it, because somebody else is probably thinking of it. And there is always going to be someone there to help you.
Yeah.
The team, when I walked in, they were hugging on each other and acted like they'd known each other for 15 years. And it had been 5 days that they were stuck in the building together. And you can tell that that sense of team will never go away now.
Yeah. I think that was my biggest, the positive, fun part about it. Yes, there's disaster happening all around. But with me, there was 35 nurses from all over the country that I knew one person whenever I showed up, another ER nurse from my hospital. Everyone else is brand new, but nurses from California, all over came. And if you can imagine the types of personalities that are willing to just show up, not knowing what they're facing and just handle it with stride, those are the types of people that come. So these are my people, right? We bonded instantly. We actually still have a group chat. It's always blowing up because we have so much in common, so much to talk about. We're still sharing our lives, even though we've been away from the hospital for over a week now. I met the coolest people. And so it's this weird mix of like, you show up to your shift, it's absolute chaos. I mean, there's just so many patients. So I'm not used to caring for that many patients at one time.
Mm-hmm.
Crazy 12 to 13 hours. But then we go back to our cots. And then it's like summer camp. And we're just like talking about our shift and talking about our lives and telling funny stories and eating snacks until 11 o'clock at night. I was like, guys, we have to go to bed. We have a shift tomorrow. But I met the coolest people that I'm just so proud to say are nurses that I get to work alongside from a distance. But we're still like talking about life, and I'll probably be friends with them forever. That was like we have a group chat called Disaster Team, and we still talk all the time. So I'm very grateful for that experience. So as you go back to your regular life without like, devastation all around you, how has this experience changed you as a person?
I definitely do not take the things that I have for granted, the small comforts of life. And also just, it really defines differently where you don't know what someone else is going through. People show up to work every day, especially nurses, and they put aside everything going on in their home life or their personal life. And it could be something catastrophic that they found out that morning. And when you walk into that room, nurses almost just are different people and take care of the patients, and that is their focus. And so it's taught me a little bit more about being sensitive to the people in the rooms and making sure that, you take that time to be checking on them and saying, are you okay? How are things going for you? Is there anything I can do for you? And it's not one of those pass you by the hallway, say, oh, hey, how are you?
Yeah.
It's the intentional, hey, Sarah, how are you? Are things okay? Do you need anything? And really trying to support people through that right now.
Brooke, thank you so much. This is a great conversation. I can't wait to get it edited and share with the Rap Response podcast community.
Well, thank you for having me.
Yeah, absolutely. Good to catch up again.
Before you go, I have an exciting announcement. You can now earn CEs for listening to this podcast. That's right. Our Renegade has teamed up with podcast hosts like me who are delivering amazing content that not only educates, but inspires you to be the best for your patients. You get to learn and earn continuing education credits while absorbing knowledge from thought leaders and innovators in the field of health and medicine. You're already listening to podcasts during your commute, at the gym, or while unwinding after a long day. So why not earn your CEs at the same time? And that's where pod classes come in. Yep, it's just what it sounds like. It's CE learning through podcast. To learn more, I put a link in the show notes for you. Well, thanks for listening. I hope you learned something that will save a life. Remember, nursing is a team sport, so trust your intuition and don't give up advocating until you are confident you've done what's right by your patient. The views and opinions expressed on this show are that of Sarah Lorenzini's. That's me and mine alone. They are not intended as medical advice and should not take the place of your institution's policies or procedures. Evidence-based practice is ever-changing, and your patient care should reflect the current best practice. So if you want to get in contact with me, you can shoot me an email at sarah@rapidresponsern.com or on all social media platforms as the Rapid Response RN.